On to a very important subject now. Outbreaks of measles, rubella and other preventable diseases are already spreading through several provinces due to declining childhood vaccination rates. Now, this has triggered a public health emergency, with the Department of Health calling for an immediate national response to these declining childhood immunization rates. The department says that the decline could be reversed or rather it could reverse decades of public health gains, including significant reductions in infant and under 5 mortality rates achieved since the mid-2000s. The proportion of infants receiving no vaccination at all has now risen dramatically over the past decade. Now, to help us discuss the implications of this, we're joined by a member of the Ministerial Advisory Committee on Child Immunization at the National Department of Health, Dr. Waasila Jassat, as well as Professor of Vaccinology at Wits University, Professor Shabir Madhi. Thanks so much to both of you for joining us this morning. And perhaps I could start with you, Dr. Jassat, in just explaining why immunization is important.
Well, vaccines have been around for decades, and immunization for children has been tested and is safe and is known to be effective in preventing illness and disease in children for many diseases.
And of course, now we see, Professor Madhi, that there is this increase, and the Department of Health says this is happening across all 52 districts. So people are not having their children vaccinated. What is the danger of that, not just for the children themselves, but for society at large?
Good morning, and thank you for having us. So firstly, just to add to what Dr. Jassat said, between 1974 and 2024, 54 million lives were saved because of vaccines. So that just shows you how powerful vaccines are. Now, what the current data tells us, and I think we need to probe the data more carefully, because if the current coverage data is correct, it would put South Africa as being one of the places with the lowest immunization rates, not just in Southern Africa, but on the African continent. And that is highly concerning. And if that is the case, what we're really facing is a very bleak future, and in a very immediate future. So what you see currently being reported by the NICD is an uptick in terms of number of measles cases, over 3,500 cases reported this year alone. Now, to some extent, measles is sort of the canary in the mine, in that it's a very sensitive probe in understanding whether children are being adequately vaccinated or not, because it spreads very readily when there isn't enough vaccination taking place. So what these data tell us is that if we don't act immediately, we are potentially facing massive outbreaks of measles, as well as many other vaccine-preventable diseases, which have been largely controlled in South Africa over the past 10 to 20 years.
So just looking at those stats, Professor Madhi, according to the Department of Health, you have now completely unvaccinated infants under the age of 1. They say that has tripled. It's trebled from 12.1% in 2017 to 36.3% in early 2026. And then it also says that first dose coverage dropped from 67% in 2025 and plummeted to 60.5%. So these are alarming statistics. But what does this tell us about, the systemic weaknesses and where things may be going wrong for us generally as a society?
Yeah, and I think those are important figures. And to put it into context, the benchmark is that we should be getting 90% coverage in every district in South Africa. So that is a benchmark, and we're way short of that. What it tells us also is that, unfortunately, our primary health care system has collapsed completely. So vaccines are sort of the cornerstone of what you provide as primary health care. So what is the reasons that's driving this? It's probably multifactorial, but certainly the weaknesses in our public sector in the primary health care service is something which is really unmarked. So it really tells us there's many issues probably at play. Certainly on the part of parents, there might be some level of complacency because of how successful vaccines have been in the past. There might be some level of reluctance to be vaccinated because of misinformation, disinformation, but I think this is most symptomatic of a public health sector, and including the primary health care system, that is really not delivering what it should be delivering to our people.
And just continuing with those numbers, Dr. Jassat, 3,462 laboratory-confirmed measles cases, nearly 400 rubella cases, and there's the spreading of whooping cough, diphtheria. Does this tell us anything about how close we may be as a society to a collapse of herd immunity?
I think we should take these numbers very seriously, but I wouldn't describe it as a total collapse of herd immunity. What we are seeing is growing immunity gaps, and the outbreaks you mentioned are showing us what happens when those gaps become too large. I'll give you an example of measles. It's one of the most contagious diseases we know. One person with measles can infect 10 to 18 other people who are not protected. So that's why we need very high vaccination coverage to stop it from spreading. Around 95% of the population needs to be protected to maintain that herd immunity, which means that when a very high proportion of people are protected through vaccination, the virus has far fewer opportunities to spread from one person to another. But when vaccine coverage fails, that protection weakens and outbreaks become much more likely. So in South Africa, we are falling well short of the coverage we need, and none of our provinces reached the target of 90% fully immunized by 1 year or 95% measles second dose. So that leaves thousands of children without adequate protection, and we're seeing the consequences of it. And as you said, we are seeing the rise of vaccine-preventable diseases, and it's a very clear warning because these diseases are preventable, and we know what works. We need to get vaccine coverage back up, find those children who have been missed, and make sure they receive the vaccines they need.
And to that point, Professor Madhi, with more than 70% of the current measles cases occurring in children aged 1 to 14, from an epidemiological standpoint, how do we do that catch-up? Do we target infants? Do we go to schools? How should government approach this?
Yeah, with that sort of population gap that has emerged, and South Africa has consistently lagged in terms of our vaccine coverage for measles. Never have we even come close to 90% for the second dose of measles. So there's a huge immunity gap that has emerged. And essentially what we probably require now is a catch-up campaign that includes all children up to 15 years of age. And that's what epidemiological data is telling us, that there's this immunity gap. And to some extent, we might also need to start considering vaccinating women in a childbearing age, not those that are pregnant, because what's also happening in the previous outbreak that we saw in South Africa, there was a substantial number of very young children that were also getting measles. But right now, the priority should be, firstly, any child under the age of 5 that hasn't received 2 doses of vaccine should be taken to the clinic immediately to be vaccinated. In addition to that, we probably need to have a nationwide campaign to try to reach every child under the age of 15.
And of course, how do we deal then with the anti-vaxxers? Because some parents have just taken a position that, they do not believe in vaccination and whatever benefits medical science may say it brings. How do we deal with an increase in that sort of mindset, Dr. Jassat?
I think we need to understand why some families who have the means to access healthcare are still choosing not to vaccinate, because we need to challenge the assumption that vaccine uptake is only a problem in poor communities. There was a survey, the South African Demographic and Health Survey, that showed that vaccination gaps exist across different wealth groups, including some of the wealthiest households. So it's not simply a problem of poverty or access to clinic. So why are families choosing not to vaccinate? I think it points to the importance of trust, confidence, and accurate information. We need to tackle the rise in misinformation that's been spreading specifically since COVID-19. Parents are exposed to a lot of conflicting information online, and we need to provide clear, consistent, and trustworthy information from credible health professionals. I think to parents, the message is simple. Vaccines are among the most carefully tested medicines we use. They go through several stages of clinical testing, and their safety continues to be monitored. And the vaccines we routinely give our children have been used safely for decades, protecting generations of children. And so, I think parents need to understand that if their child has missed a vaccine, they should take their Road to Health booklet to a GP or clinic and check which vaccines have been received and which ones can still be given and when.
Professor Madhi, with regard to polio, and South Africa has had polio-free status since 2014, but now they've detected in Cape Town's wastewater imported polio virus strains. How concerned should we be about this, in addition to the fact that we are seeing a drop in immunization?
Yeah, we obviously need to ensure children are vaccinated against polio, but I wouldn't be too concerned about the detection of what we refer to as vaccine-derived polio virus in wastewater. The more wastewater surveillance you do, and especially if you're using sort of oral polio vaccines, which we're currently doing in South Africa, as well as our neighboring countries, you're going to have this detection in wastewater, and especially if you don't have high vaccine coverage. I think polio is probably one of the lesser concerns. The bigger concerns are, like Dr. Jassat mentioned, issues around measles, around pneumonia because of pneumococcus, around tidal disease for rotavirus. Those are much more important, and we're going to start seeing an uptick in number of hospitalizations for conditions that we had brought under control. So yes, polio is on the radar, but certainly South Africa, we haven't had a wild type of polio case for more than 30 years now.
And that's on the one hand where we look at the parents and their choices, but on the other hand, there's of course a concern that's been raised by public health experts that provincial departments are facing budget deficits, and then they end up being selective about which vaccines they actually procure. So is the Department of Health taking steps to ring-fence vaccine procurement funds at a national level in order to ensure that there is at the very least a consistent supply of these vaccines, Dr. Jassat?
Vaccines are an essential health service and funding for immunization must be protected. But I think it's important to distinguish between funding and supply and the reasons children are not being vaccinated. So at present, vaccine funding and availability is not the main problem. Vaccine stocks are closely monitored through real-time stock dashboards, and vaccines are not often unavailable at facilities. And where there is a potential supply problem, it is identified and addressed. So we don't assume that children are missing vaccines because provinces are simply not procuring them. Ring-fence funding can protect the supply and provide better certainty and accountability. And we already have an example with a conditional grant for the HPV vaccine, where funding is specifically protected for that program. But ring fencing is not the only solution, and it also has to be balanced against the need for provinces to manage their overall health budgets and respond to local priorities. But the main point is having a vaccine in the clinic fridge is only the first step. The bigger challenge is making sure that every child who needs that vaccine actually receives it. So the National Department of Health is responding to this crisis through an immunization in Daba to address it, developing an immunization recovery plan and launching a new national immunization strategy. And we are also undertaking a vaccine confidence study to better understand the barriers to vaccination and how we can address them.
And just to follow up on that question, so with that catch-up vaccination campaign, as it were, how will healthcare workers know where to locate, where to track down these hundreds of thousands of lost or zero-dose children who were born over the last few years?
I think our information systems are inadequate to properly follow up, doses that have not been given and children that need to be caught up. And so at the moment, we're relying on, families presenting to GPs and clinics and healthcare workers and community healthcare workers being on the lookout for children who are unvaccinated. And I think, as Prof. Madhi said, campaigns will help a lot, where we go out to schools to have mass campaigns at schools. But one of the problems we find is that we don't get consent from families when we do mobilize to do school health campaigns. And so I think it's a question of having the services available, but also informing the communities about the importance of consenting when these campaigns are available. And I wanted to make a comment about the zero dose. I mean, it's a serious warning that too many children are not being reached by routine vaccination services because it's an indicator of their access to primary health care. So if a child's not receiving any vaccines during their first year of life, there's a good chance they're also not being reached for other important child health services like growth and development monitoring, nutrition screening, HIV testing where appropriate, and other preventive care. So it's not only an immunization problem, it can be a sign that vulnerable children are being missed by the health system more broadly.
Professor Madhi, how can the National Department then collaborate more effectively with academic medical institutions to continue to help streamline vaccine deployment during this active emergency period, but also to Dr. Jassat's point, in terms of the messaging, how can they do better to make sure that parents understand why this is important?
Yeah, so I think a lot needs to be done in terms of communication about the importance of vaccines. Like I mentioned earlier, I think one of the challenges that we do face in South Africa is a complacency that has set in to the country in terms with regard to vaccines because of how successful vaccines have been. If parents were experiencing their neighbors' children developing measles, they would be running to clinics and making sure their children are vaccinated. But we don't see these diseases that often nowadays, because of the success of vaccines. So the complacency that has set in is an important feature. And to address that, we really need to, again, have a strong advocacy in our communities. And that needs to start not from National Department of Health. We need people that are trusted role models in the community that take on that mantle and make sure that they get the communities to understand, the church leaders, the imams, the Hindu priests. Those are individuals that need to come to the fore, or else we're going to end up in a very, very sad situation in many communities in terms of the current trajectory. So this is not the responsibility of academics. Academics can assist in terms of sort of brainstorming different sort of strategies. The implementers here is the Provincial Department of Health, the District Department of Health, under the guidance of the National Department of Health. It is their prerogative and their duty to be ensuring that our people are adequately vaccinated. So the buck really stops at the Department of Health. They need to take on they need to take responsibility for why we got such low vaccine coverage to start off with, and they need to make sure that they put forward the resources to ensure that we have a quick catch-up, especially of these. Especially for vaccines against diseases that are highly infectious, but also for the rest of the vaccines.
So I want us to end off this discussion by using it as an opportunity for a public service announcement from the two of you as people who are highly knowledgeable in this field to maybe just speak to people watching right now, parents whose children may not have been immunized, just to bring the message home as to why it is important to have those children vaccinated. I'm going to start with you, Dr. Jassat.
I mean, I think the important thing is that there's no blame on parents. You know, we know that there's many reasons why kids don't get vaccinated, and it's both reasons, problems with the health system, but also problems of lack of access of awareness and information and misinformation. But I think, you know, my message is very simple. As I said before, vaccines are very carefully tested. They are safe. We continue to monitor their safety. They've been used for decades, and they've been shown to protect millions of cases of severe illness and death. And so, you know, if your child has missed a vaccine, don't assume it's too late. You know, go into your GP or your clinic, look at what vaccines need to be caught up and ensure that those vaccines are given. And for parents of young children, you know, these are choices we make for our children, and to ensure that they receive good health care, they receive good screening, and they receive all their vaccinations so that they are well protected should be a priority for any parent. And so I encourage parents to be armed with correct information from trusted sources and to ensure that their kids get all their vaccinations.
Professor Madhi?
Yeah, so I'm a pediatrician, and I did my training in the 1990s. And even in the 1990s, there were hundreds of children, and I'm not exaggerating, that used to die each month at Chris Hani Baragwanath's hospital because of measles, because of pneumonia, because of diarrheal disease. That was in the 1990s, before South Africa had a fully established immunization program. 20 years later, there were almost no children that were being admitted for measles. We had massive reductions in pneumonia and diarrheal hospitalization, and that was because we started to introduce new vaccines and leverage on vaccines that previously existed, which our children were not receiving. So for me, the message to young parents especially is that you don't understand how many children used to die from these vaccine-preventable diseases. Speak to your parents, speak to your grandparents. They will be able to share with you the number of other children that died in your family in the 1980s, in the 1970s from these vaccine-preventable diseases. Vaccines are here to save lives, and if we don't make use of that opportunity, we will pay the price.
Well, thanks so much to Professor Shabir Madhi, a professor of vaccinology at Wits University, and Dr. Waasila Jassat, a member of the Ministerial Advisory Committee on Child Immunisation at the National Department of Health, speaking about South Africa's declining childhood vaccination rates. And you heard the messages from the two professionals, and also it's not too late, as they said. So if you can, still go and get caught up.